still have a lot of muscle tension and soreness and stiffness in through your chest and shoulders after your ACDF surgery? Are you getting tension headaches frequently? Well, I am, and I am here to show you some things that have really helped me relieve some of that tension and relieve those headaches. I'm Amy Giaquinto, I am Mama Fix-It, and this is my ACDF recovery journey. So today I want you to go and find a racquetball. If you don't have a racquetball, you can use a tennis ball, but buy a racquetball at some point in your future. Racquetballs are great because you can use them to self-massage and dig into some of that sticky tissue in your pec region. You can also roll up here near your collarbone. You know, you have a lot of muscles, neck muscles that attach near your collarbone and below. I'm sorry, my dog seems to be whining. He didn't get his WALK today, yikes. But anyway, if you roll these out, you can start breaking up some of that nasty stiffness and tissue, and it'll encourage some blood flow into the area. Also, if you're prone to headaches after ACDF surgery, which I have been because it's mostly muscle tension, oh my goodness, now apparently my kid's fake stove is going off. You never know what you're gonna get when you watch a Mama Fix-It video. Anyway, you can roll some of these muscles up in here and it feels really good. Ladies, watch your hair. Excuse me. I just not gonna be able to demo this right now. As I was saying, if you pull your hair up, you can roll up in here and get some of those knots out of your neck. And it feels pretty good. And if you find a spot that is a knot, just hold it. Hold some pressure on there. And then gently move around. You can breathe into it and let those muscles relax and calm down. Get some of those clumps broken up. The other thing you can do too with this ball is you can use it on a wall. I'm gonna stand up and show you how. You're gonna wanna find a corner of a wall and you're gonna stick your ball right here and you're gonna put your arm at 90 degrees. I know it's kind of hard to see. And you're just gonna push into the ball here, and roll some of that tissue. That feels really, really good. Make sure, see, I've got a knot right there, and I'm just gonna hold that and breathe into it. Oh, yeah. It's gonna feel tight. It could feel kind of a little painful, but not in a, like, I'm gonna die sort of way, just in a, I have a knot right there, painful sort of way. So it almost feels good. It's a little masochistic. So you can roll this, just rolling, rolling, rolling. The nice thing is too, you have this, you can put this here and you can do your back with it as well. So just pull your hair up and get it there and just roll right along those shoulder blades. Oh, it feels good. Kind of balance this back here. And then as you can see, I can roll my ball down and up. Oh yeah. And you can feel it. If you roll right along the edge of your shoulder blade or even right on your shoulder blade a little bit, it feels so good because those muscles get gnarly, gnarly tight when you've had a neck collar on. They get gnarly, gnarly tight even if you have to sit at a computer all day or just by living because we tend to hold a lot of stress back there. And what are we doing most days? We're pitching forward. So these muscles tighten, these muscles get a little hyperactive and angry for being loosened. So yeah, go ahead and roll those out like that. For the next way to alleviate pain, get some mobility in this neck region and alleviate some of the stiffness in the muscle, you're gonna want 2 racquet balls and a sock, clean sock preferably. So I borrowed a sock. You can see that it probably should go in the trash as a normal sock because it's see-through. And it's also my husband's. And he has a hard time throwing away socks. So you want to stick both of these balls in your sock and push them all the way down. And what I like to do is just give a little bit of room between the socks because you're going to put this on either side of your spine. So this is where the spiky strips of your spine are going to be, so we don't actually run over them with the balls because that would be bad. I also tie my balls in. I give a little slack so that I can move these around as I need. And then we're just going to put it on our neck here, like this. Again, you see the spinous processes here? You don't want the ball here. You want it on the either side. And then we're gonna lay down and we're just gonna roll this up and down. And believe me, that's gonna feel good. Let's go down. So I have my balls and I'm just gonna roll. And I can move my head just gently to the side and let those balls massage into those muscles up here. And it especially feels good like around the base of your skull. Like I've got a pinch right now that holding this and relaxing my shoulders, it feels amazing. Again, do some breathing while you do it. And you can move, reposition it, and just let it slide down the base of your skull. And you can roll it with your hands if you want, or you can roll your body. You can just kind of push your body up and down and roll. And the nice thing about this is if you want to self-massage your actual spine too, like lower down, you can do the same thing. You just set it on either side of your spine, like this. And you can put your hands up by your sides like that and just roll. Sometimes I like to find a spot and just hang out and work on a knot and just let it go. But it feels so, so deliciously good. And I guarantee it's gonna help you loosen up some of these muscles and get rid of some of that tension. This really works well when you have a tension headache. If you can combine this and a little menthol, I put the menthol here and at the base of my skull a lot of times. That makes a huge difference, and I can often function by that, and sometimes I don't even have to take the Tylenol when I have those kinds of headaches, which is really great because I can clear it up myself. The other thing you can do, speaking of neck, is you'll want your foam roller. We're going to stick our foam roller here, and we're going to lay on it here. And again, you're just going to gently roll and then kind of roll onto your side and work some of the rolling out some of these muscles up here because they get stiff too. So you can even just lay on it. But here, roll just gently. Roll it nice and gently, nice and easy. Absolutely nothing should hurt when you're rolling. Like a little bit of muscle pressure is fine, but nothing should hurt. If it hurts, don't do it. That is the biggest lesson you have to learn. No pain, no gain. That's bogus. If there's pain, you will have no gain, okay? Especially with ACDF surgery. So here again, you can just kind of lift up. I'm lifting up my hips a little bit just to try and roll it out. And just like that. One of the best stretches you can do when you're having stiffness here in the chest is to do a chest opener. And I like to do it on my foam roller. I'll show you another version on the wall here in a moment. Get on your side. You can get on your foam roller here. Make sure your head and neck are supported. Do the chin tuck, or you're tucking your chin here, and your back should be flat against your roller so that you can't stick your hand underneath it. If it's arched, that's not good. So nice and flat, tuck your chin, and just put your arms out to the sides here, and just let it hold it. And you'll start feeling a stretch like all the way up through here, which feels really good. And sometimes it can get quite intense. If you're losing circulation or you're getting any kind of nerve pain or tingling in your hands, then don't go quite as far. You can bring it up a little bit, but the whole purpose is to open your chest. And I like adding a little movement to this too. Come down here, I'll work through it. Like right here feels good. I'll move my head from side to side, keeping that chin tuck and making sure that my lumbar spine is pressed firmly against the foam roller. But that is great. You can even move here and do like you're making snow angels. I want to show you the other chest opener that's over on the wall. To do this one, you want to go back to the corner of your wall. You can put your arm up at 90 and your elbows supported. Tuck your chin. The leg that's closest to the wall is going to step forward. And all you're going to do is lean, like press your hand and your elbow against the wall, lean forward with that chin tucked, staying nice and straight and lined up, and just hold that stretch. It feels really, really good. And while you're here, after you've held it for about 20 seconds, play with different positions. Can you move it up a little bit and hold it up? Oh yeah, that's gonna open some stuff up. Can you move it down a little bit? It's probably gonna relieve some of it. You might be able to go a little farther. But work within that range of motion here, where you're just holding. If you find a spot, hold it and work on it some more. You can even do a little bit of self-massage while you're here, just kind of rubbing through the muscle. That'll help enormously as well. Make sure that you're doing both sides. And you can do this several times a day. It's actually really, really great for you. The next one I'm gonna do requires a door frame. So let's go find a door frame. We're just gonna go into the door frame right here, and we're gonna do another chest opener. So you want your hands, arms at 90 degrees, and just tuck your chin, and again, just step forward. Oh, and let both sides of your chest open at the same time. This, again, feels really great, and it's a really good one if you have to sit all day, especially after ACDF surgery. It feels good. But see here, you can straighten your arms out a little bit, and come in a little farther. Turn your head. Really work through those different ranges of motions. Make sure your chin is tucked so you're not out here. We're not chickens. Okay, sorry. Okay, then you can lower, and you can also go here. And I noticed this the most, the nerve that was really jammed up before my ACDF surgery, and now after, this one running down here, I can feel it kind of pulling a little bit. So I really like to be able to loosen it up with this stretch. And again, nothing should hurt. It should just feel really good. Doesn't that feel amazing? I think it feels amazing. All right, I'm gonna show you one other trick that I really love to help loosen up all of these muscles and make yourself feel really good. So I was talking with my massage therapist about how stiff and sticky I am and how I can't always get in for a massage as regularly as I'd like. And she recommended buying some silicone cupping cups. So I did, and these are available on Amazon. I'll leave you a link down in the description below. But anyway, to use these, it's very simple. I don't know if you guys had any of those like little poppets when you were younger where you used to like, you know, flip them inside out, stick them on your skin and wait for them to go pop. But these work very, very similarly to those. So the only thing you want to do is you want to take some of your oil. I have my coconut oil here. Rub it on the section that's bad. I'm gonna go over here since I have already cupped on this side, and you don't wanna cup again where there's already a cupping kiss, as they call, which is basically a bruise. And then you're just going to push down on these guys like this, so you can flatten them, and then stick them to your skin and let it suck on there. And that is working. I usually leave these on for about 2 to 4 minutes. Sometimes if stuff is really tight and sticky, I'll kind of move them around a little bit. Oh, that feels good. Just to kind of break up some of that tissue, and it feels great. The other thing you can do that is amazing and works super well to help break up tissue and get blood flowing is you do this massage technique that's known as rolling. So you kind of skin roll. So you pinch your skin and you just work your fingers up and you just roll it out. And you're gonna find some tightness in some areas, especially around your scar. That's not gonna feel amazing, but it breaks up so much of that scar tissue around your scar. Like I said, not my favorite, but it really feels good when you're done. Sometimes it doesn't feel too bad when you're doing it, but I like to walk it up when I'm doing this, up my neck, and especially among these sternocleidomastoid muscles, and then on the back of my neck, all the supporting muscles that you have in here. So just wherever it's stiff, just do this little self-pinch skin roll technique, and that helps lots. And up and through here too, this, again, this is the attachment site for a lot of your muscles. So just get in there and just roll it out. And yeah, you're gonna be red. And so when you're done with your cup, you just pull it off. And look, I have a cup kiss. Isn't that so cute? Yes, you're gonna look really funny. You're gonna have cup kisses, but they do go away. It is not a big deal. You're not destroying anything at all whatsoever. If it's too painful, don't do it, okay? One of the things that you need to be aware of when you're using cups is you do not want to cup any area where you have lymph nodes, because you don't want to risk damaging your lymph nodes, okay? So where are your lymph nodes? In your upper body? You know, when your doctor's feeling right here? Well, you've got some lymph nodes up here. Don't cup here, okay? You have some lymph nodes under your armpits. And if you feel, usually you can find them because it feels like a little sack of peas almost in there. There's like a bunch of little peas. These are more oblong up here. So, you know, you have lymph nodes in your groin area, you have lymph nodes all over your body. Just look it up. I'm just gonna show you these up here because this is the main area that we're treating. You know, the other thing too is you don't have to just cup your neck and chest. You can cup your shoulders, you can cup your back. I've cupped my neck before. That has felt really good, especially when you massage it up and down, because it just pulls that tissue up and gets it moving. I've done my triceps, my biceps, my elbows, my shoulders. I mean, you name it. It really does help make you feel better. It gets blood flowing to the area. It puts in nutrients. It takes out the waste, and you know, you can move a little bit more freely, especially if you're doing your stretches regularly and a lot of the exercises. I know I've shown you some, but in the next episode, I'm going to show you some additional exercises as well that really can help break up the congestion, as I like to call it, muscle congestion in this area. When you are done with your cups, all you have to do is wash them with soap and water and let them dry. I even have this cool carrying bag right now for my cups. So I wash them, I dry them, I toss them in there, and there's even a little guide that they have to show you how to use your cups, even though it's not very comprehensive, but pretty cool little setup. So for very cheap, for, you know, a couple balls, a foam roller, and some cups, you can get a lot of relief on your own and save a ton of money on some other therapies like massage therapy, and especially when you don't have time to get in. With that, I'm gonna let you go and give these a shot. I would love to hear how you like them and what they're doing for you, if anything. Please be sure to contact your doctor or your physical therapist or an expert before you begin these. Again, remember, if there's any pain, there's no gain. And with that, go try them. I'm Amy Giaquinto. I am Mama Fix It. Be sure to stay tuned for my next weight loss video, which is coming up very, very soon. I'm working on it right now. I'm going to show you some more exercises you can use to help lose weight. And then in another episode, we're going to talk about nutrition and diet and the importance of that. And we're going to talk about more behavior. It's going to be so exciting. So please, please, please click that subscribe button so you can stay informed and so you never miss a video. Also, if you want, you can turn on that little notifications bell, and then you'll get bing, a notification when I send out a new video. Until next time, see you later. Have a wonderful day. Good luck recovering. Bye.